thank you for coming to the presentation about Shiatsu. And basically, today I want to talk about what I believe is one aspect of Shiatsu that is very little expressed when people talk about Shiatsu. I don't know how much you know about it. I don't know whether you have experienced Shiatsu or you have just heard about it. But when I talk to people, and I mean non-professionals of Shiatsu, although they might do other types of body work, they all seem to have read about, let's say, the philosophical aspects of Shiatsu, or the theoretical aspects of Shiatsu, but they seem to know very little about the practical aspects of Shiatsu. Now, why I think this is important is a bit of a long story, but I'll try to make it as short as possible. I graduated in 2001 in Spain in Shiatsu, and I was for 6 years volunteering in a hospital where we went, not only me, obviously other people, for children on dialysis. They were there for 3 hours or 4 hours, having the blood changed, and we just gave them like about 30 minutes Shiatsu before they were connected. And we went there for 3 days a week. The parents were very happy. Most of the children, there were 1 or 2 who refused the Shiatsu, but most of the children were very happy. The nurses were completely happy. The doctor in charge of the dialysis department was very happy. And then several years later, I arrived in London, that was in 2010, and I said, well, I want to volunteer giving Shiatsu in hospitals there. And I was rejected, I don't know how many times. Shiatsu is not acceptable. Shiatsu is not acceptable. Shiatsu is not acceptable. Shiatsu is and I began asking why. Most of the people never replied when I asked why. But one person from UCLH, University College London Hospital, replied, because Shiatsu is very hard, it's very painful, which really shocked me. That has shocked some of the Shiatsu therapists to whom I have explained the same thing. They said, what does he mean? Because it was a he, what does he mean by being painful? However, it is a notion that apparently is very widespread. Slava and I were working in one place, and we were talking about this man who has a spa, and he said, oh, all I do is deep tissue, and Slava said, I only do Shiatsu, and the guy said, oh, that's very similar. Shiatsu and deep tissue is very similar. And one of the other therapists said the same thing, oh, yeah, some styles have very, and I was just like even more shocked because as far as I know, they have nothing similar. I remember the change in myself, in my pressure, in the quality of my pressure from being a first-year student just to being a second-year student. Later on, I began teaching, and I saw that again and again. Even the worst student who had finished the first year, the pressure was much nicer than any of the best that were starting the first year. The difference between other techniques is that in Shiatsu you use exclusively the weight of your body. It is, if you want to put it like that, an effortless thing. I forgot to say, after 5 years trying to get into a hospital, I managed to get into a hospital. In London, I've been doing the volunteering for 3 years now. That's with cancer patients. It's not only Shiatsu they offer massage, they offer reflexology, they offer Reiki. And they were looking at me, and I was explaining the difference between, pressing like this, and doing it with the weight of the body. And actually, when I did that, it was very curious. I was doing the practice with a Reiki therapist, and the first time I did it with just like pressing like this, she just grimaced. And then the second time, she just didn't. And the other therapist asked her, oh, that's very light. And she said, no, it's not light, it's deep. My pressure is deep, but painless. And this is what I believe is what hasn't really happen in other techniques. When I try tuina, when they go deep, they go hard. It's painful. So in deep tissue, when they want to go deep, in most people, it is painful. Now, of course, I have to qualify that. That doesn't mean that if you have a problem in one area, because whatever, osteoporosis, it cannot be painful with normal pressure. But I mean, in general, shiatsu is painless with a deep pressure, or can be painless with a deep pressure. Now, this has many advantages. From my observation, I don't have any proof of it, but in my observation, people relax much more quickly and much more deeply when pressure is deep. Now, if it's deep and at the same time it's enjoyable, and there is no trick to learn it except precisely those two things, to let go of trying to do it, to let go of intention of trying to press. And many times when with beginners, when I teach beginners, you even see the change in their face. I tell them, for example, yeah, you don't have to do anything, all you have to do is lean, yeah, and they believe they're not pressing enough. So not only they push with their arm, but you see even this change in their face. They go, which is very curious, and then you see the person receiving. There is some intention on how I put my hand, etc., but there's no intention of pressing. I just let my body, relaxed weight of the body, fall on there. I'm doing nothing. All I'm doing is rocking my body so that the full weight falls. Yeah? I'm not, excuse me again, I'm not pressing. I'm not doing this. I'm not using the strength of my arms. Okay, and that's partly what I said about the differences between shiatsu and acupressure in my paper. There were other differences, how you put the thumb, but they're related to this again. Yeah, if I want to let the whole weight of my body, I cannot have the thumb bent because all I do is injure my thumb, so I have to use that.
I've had a very bad shiatsu massage that was just, can't have been professional, it was just like really hard pressure, poking, and it was just painful. It was so painful.
Try
to do it wrong.
To do it wrong, for example, yeah, just do it there and just
press.
That's
like
it.
that.
Yeah, but you don't have to do it. You don't have to do it with so much intention. Just press normally. Yeah. Okay. And now just do it like that and just let your very relaxed weight of the body. That's it. Nothing. You're doing nothing, and she can tell you the difference. I was just explaining that I have that many people mistake strong for deep, yeah, or hard for deep. I have given shiatsu to some sports massage therapies, and they say, "Oh, your pressure is very light or very soft," because they think that if it's not painful, then the pressure is not strong enough. While if I give it to everyone else, they just tell me, "Oh, your pressure is really deep." Just because it's deep, it doesn't have to be painful at all. That's my whole thing. Yeah? However, it is difficult to do it on people who are used to pain and they like pain, and because they think, yeah, some people think that if you're not causing pain, you're not doing anything. Yeah, even people who at the end of the session are like completely relaxed, half asleep, they still want. Yeah, you haven't done anything. They still want the pain. Incidentally, I can do very light pressure as well. My pressure can be deep, middle, or light, because some people need light pressure. I forgot to say a couple of things in my talk, and that's why I'm adding them here. Although there are other things that can influence how hard or painful the pressure is perceived, the relaxed weight of the body is the most important one. It doesn't matter, for example, if I press with two hands, if I don't use the weight of my body, it's still painful, as you can see. While if I use the weight of my body, it's much nicer. And is the same if I use thumb of the thumb. If I use thumb of the thumb without using the weight of my body, you see that is very hard. While if I use the weight of my body, it is very nice. Thank you for listening to my presentation.